All right, a new study has announced 1 in 3 women with breast cancer detected by mammogram are actually treated unnecessarily. And here to explain exactly what that means is Dr. Chaffoo. Good morning, doctor.
Good morning, Kristina.
So let's start with 1/3 seems like a very high number. First of all, how is this possible? What exactly does this mean?
So, Kristina, this was an interesting study that just came out in the Annals of Internal Medicine, and they looked at thousands of women followed in Denmark, and they have a national health care plan over a 10-year period. And what they found was that if they looked at early mammographic changes and they followed these women over 10 years, the researchers felt that about a third of these abnormalities or early changes that were seen on mammography, if they were followed over a 10-year period, really did not develop into breast cancer. And so the researchers extrapolated that perhaps we are over-treating women by abnormal mammograms. Now, the interesting thing, Kristina, is there is another study that came out also from Denmark that looked at this issue of are we over-treating women with abnormal mammograms, and they found actually completely different evidence and different conclusions. They found that really over-treatment was only about 2.3%. So it's a study that's interesting, but it has to be taken in context of what we really know about early detection and treatment of breast cancer.
So it's not suggesting that women, take this lightly or perhaps stop getting mammograms done, correct?
Absolutely not, Kristina. You know, we know clearly researchers have shown us compelling evidence that screening mammography reduces the risk of dying from breast cancer by almost 30% in women aged 40 to 69. And so the study, while interesting, is not going to be enough compelling evidence to change the way that we diagnose and treat breast cancer. You know, unfortunately, 1 in 8 women get breast cancer in the United States. Roughly 250,000 women a year are diagnosed with cancer. There are about 41,000 deaths from breast cancer a year. And it's the most common cause of cancer in women. You know, 1 in 8 women, unfortunately, will get breast cancer in their lifetime.
So how exactly are doctors now working to make mammograms more effective?
So the big issue is that the American Cancer Society has come out with guidelines of when women should get screening mammography, and the latest guidelines from 2015 suggest that women should start getting screening mammograms at the age of about 45 to 54 yearly, and then after 54 every other year. Of course, that could change depending upon your history, you know, findings on physical examination or mammography, but those are the general screening findings that are recommended at this point.
So what should women ask when they are getting their mammograms done?
Well, the most important thing, of course, is to make sure that they want to ask the physician that's doing the mammogram to go over the results with them, and if there is an abnormality on mammogram, what are the different treatment options that are available. You know, the most important thing that we don't want to do is we fear not diagnosing early breast cancer, because breast cancer, like any cancer, is infinitely treatable when it's caught at a very early stage, and unfortunately it has, dismal implications if it's delayed in diagnosis until it's much more advanced.
Okay, and my last question, doctor, can this study also lead into other types of cancer treatments perhaps?
Well, the study will help us to determine, whether or not, if there's certain mammographic changes that these researchers found in Denmark that may suggest ways that we look at markers, or ways we look at are there treatment options available long-term for people. And we really didn't see that from this research. It just basically looked at following very early changes, but what are those changes, what are those signals or markers that may then distinguish between those that don't need to be followed but need to be evaluated early on. You know, the take-home message, Kristina, I think for our viewers is you want to do frequent self-breast examinations. You want to see your physician yearly to have mammograms done, or at least an evaluation, an examination, and then continue to follow those guidelines, at least at this point, the American Cancer Society, of getting your yearly mammograms from the age of 45 to 54, and then every other year thereafter.
All right, Dr. Chaffoo, we do appreciate you being here and explaining this for us. Thank you.
Time now.